welcome. My name is Marcus Palermo, and I'm going to be presenting today on the GentleWave system and translating efficiency into economy and some of the ROI benefits that I've noticed within my own practice in Santa Fe, New Mexico. So just a quick disclosure statement. I am a key opinion leader with Sonendo, and certainly you should be doing all of your own research and vetting before investing into new technologies within your practice. So a little bit about me. I practiced in the Phoenix area when I finished school in 2007, and practiced in a lot of different settings, anywhere from fee-for-service, very high-end Scottsdale practices. Worked in very heavily insurance-driven practices. Worked in a multi-practice or multi-specialty setting, and predominantly I was doing a lot of multiple visit cases at that time. I relocated to Santa Fe in 2012, and at first when I opened the practice, I was nearly 100% multiple visits. The biggest factor was I had the time to do that, and I felt the cases just turned out better, and I was a lot more confident in my results by doing that. But currently I'm nearly 100% single visit, and that's a great deal to incorporating the GentleWave system. And basically what I was looking for, and I've done this through my whole career, is how can I get more efficient and more profitable, but still maintain the high quality and success potential that we're all striving for. So we all have these sort of moral compasses and dilemmas, and for me, you know, endo fees are high compared to going in and having a simple cleaning done or a minor restorative procedure. And I always anticipated that patients were more interested in a lot of my time. And I spent obviously a lot of time on my treatments and procedures by doing multiple visits. And I just felt like patients were going to think they were shortchanged if I hustled through those procedures and got them through efficiently. Of course, over the years, this was getting me kind of burnt out on doing a lot of multiple visit cases, not seeing the profit potential, and realizing every time I rebooked the patient, my profits were cut at least in half. And I just seemed to be fighting an uphill battle in terms of being able to address all the anatomy and factors that are involved in achieving high quality endo and successful results. So I brought the GentleWave system into my practice in March of 2017. So we're 4 years in. At the time I incorporated it, we were about 50% 50% multiple visits at that time, lots of calcium hydroxide. I was having a love affair with that stuff, used it quite extensively. I had patients sitting for 2 to 4 weeks in temporary restorations routinely. And at the time we were obturating about 2.6 cases per day. Of course, as an average, we would see 4, 5, maybe 6 procedures during the day, but again, a lot of them were open and Medicaid appointments. So currently, we're doing about 98% of our cases in a single visit, and our averages are just a little over 5 cases a day. So we have nearly doubled the practice in just a few years' time. So when I first started using the GentleWave, I contacted all of my top referrals, particularly the top 5 that were the majority of my practice flow, and spoke with them personally about what the technology was, what my goals were with bringing it in, how it was going to affect my practice flow, but also how it was going to benefit the patients and certainly them as the referring offices. And we were looking at some of the clinical changes that were going to be coming and explaining to them that my cases were going to start to look a bit different, more conservative, which of course the restorative doctors tend to agree and like a more conservative endodontic approach. And the biggest factor for me was educating them on the fact that I was transitioning from a heavy multiple visit practice to a predominantly single visit practice. I had sort of conditioned and indoctrinated them into this belief that you needed to spend a lot of time on these cases, and I was making a complete 180 flip in the matter of just a few weeks' time. So when I brought the GentleWave into my practice, I was under the assumption and the impression that it was just an irrigation adjunct, and that is completely wrong. That is not at all what the GentleWave system is. It is a completely different way of approaching endodontic treatment and care. But I started off doing everything I was always doing before and simply adding GentleWave to that process, which created a lot of headaches. It added a significant amount of time to my procedures in terms of the single appointment time. So we were constantly running late at first and trying to figure out how to dial some of that back in. I was also creating some of my own problems in terms of predictability for completing cases, specifically related to obturation and such, in terms of how you approach the treatment factors and the use of files and everything else from the clinical recommendations. It took me about 90 days to turn myself around and realize that what Sun Endo had been telling me from the get-go was the way that the technology needed to be used. And once I started following their recommendations and changing my treatment modalities, I really started to notice a significant increase in efficiency and a lot less stress over time. So that first year, our number one focus was to transition from a multiple visit to a single visit model. I was really pushing myself to do everything I could in a single visit within reason, of course. I definitely was 100% all in on using the GentleWave for every single case that I possibly could. In my mind, it was such a revolutionary change and an expensive venture for me. I did not want to have it just sitting on the side and pick it up occasionally. I wanted to make sure I used it as often and frequently as possible. And we saw some pretty quick and immediate changes just in terms of the patient and practice flow, in terms of how people were feeling after procedures and the efficiency of being able to get them through the office and back to their restorative dentists in a timely fashion. And we certainly started focusing on some marketing efforts and educating everybody in the community, from the referring offices, the entire team of the referring offices, as well as obviously the patients. And so we did host some marketing events about 60 days after I brought in the GentleWave. I brought out about 20 different offices to a dinner event and went through some of what the technology was and showed them some of the cases that I had completed in that first couple of months, to let them see what the look was and how things were different, and the way that we were going to be able to be more efficient and be providing some higher quality care. And we were able to pick up 2 or 3 new referrals from that meeting, some really good restorative dentists in our community here that I had been marketing to for several years leading up to that, and just couldn't turn those referrals until we brought that in. So with the practice marketing aspect, we brought in GentleWave verbiage, and I tried to make sure we put logos everywhere we possibly could. You can see sort of a screenshot of my website there in the background. We had links there for doctors and patients to go on so they could educate themselves and learn about what it is that we were doing, and particularly about what we're doing that set us apart from other endodontists in our community. And all the marketing items that we were bringing in, I make sure that we put the GentleWave logo everywhere we possibly can. And we focused heavily on training the entire office team to be using that verbiage and talking about GentleWave, not to the point of feeling like it's a pushy sales pitch, but to make sure that patients realize that there really is something different that we're doing in our practice here. So a couple of years into this, at the time that I brought in the second GentleWave unit, hosted another dinner. This one, we had about 100 attendees. It was remarkable and flattering to see how many people were really interested in learning about this technology. Word was sort of out on the street. People were talking about how we were getting through these cases and how they looked different and how happy the patients were. And that event really ramped up our referral breadth or broadness of dentists that we work with in our community, and got a lot of new referrals out of that. And some of them that we had been working with previously who would sort of kind of spread the wealth, if you will, to myself and other endodontists in the community, would suddenly start telling their patients. My receptionist would say, well, I heard the doctor in the background telling the patient that they needed to make sure that they saw you and they needed to get a GentleWave root canal because they felt so strongly that that was a real important factor for what was going on. And so through that second year, we were heavily focused on efficiency. The first year was really getting into that single visit, but now we're working on streamlining the practice flow. I had a full-time marketer that came in, doing monthly visits to referring offices, making sure that we send recall reports showing the healing when we're getting patients in, particularly on those short-term healing recalls in just a matter of a few months, and just starting to add more and more marketing items to our inventory. Things like shopping bags, mouse pads are great to give to referring offices because they can sit and look at your information and contact all the time, and you're always on their mind, and various other things that we've incorporated as well. I also changed my referral pad and went to a trifold brochure. You can see here, this is the front panel with my photo on it and the map and all of our contact info. The back panel is for the offices to fill out. We tried to make this so that it was going to be efficient and streamlined for them. Of course, you have to make sure you get some sort of a matte finish so that any type of a gel or running ink pen doesn't smear when they're writing on it. When you unfold to that first panel there's a brief discussion about cone beam technology. We take a cone beam scan on every tooth that we're going to treat, so it's just helpful to educate patients on that, and also the referring offices as well. And then in the center of that trifold brochure, there's the GentleWave information relative to communicating to patients what it is that we're doing and what exactly is going to be happening when they're in our practice, and how we're going to be different than anybody who's doing standard root canals. So just to show you a couple of quick cases here, this patient came in, they were in a temporary crown, and the tooth kind of flared up very shortly after preparation. It was depressively mobile, class 3 mobility. You could kind of push it up and down. You can see on the cone beam slices here that there's significant bone loss in the furcation. The distal root has almost complete granulation tissue around the entire thing. We were concerned about a fracture, but we decided to go ahead and give it a chance. Had clear communication with the patient about the possibility of a fracture, and if I see a clinical fracture, then obviously we change course and recommend extraction. But in this case, we didn't see that, so we went ahead and finished. We did this in a single visit, and we were able to follow up with the patient about a month later to make sure that her buccal pocketing had reduced, which it did. It went from about 10 to 2 millimeters. And here it is at the 3-month recall to make sure that we did see bone regeneration before she had the permanent crown cemented. And you can see pretty clear evidence here on the cone beam scan, the difference in just a few months and how much significant bone healing we see, particularly through that furcation area. And of course, noting that the anatomy is pretty readily maintained. We're not really changing the shape of these canals. It's great to see in these isthmi, and we had 3 mesial canals that we located and filled in this procedure. And you start to pick up a lot of apical anatomy, and seeing that a lot of these cases that I would have been very reluctant or maybe not even willing to treat before are now turning out to be successful. So here's a maxillary retreatment case. This patient came in. The procedure had been done by a general dentist about 1.5 years prior to her coming in to see me. She was in a lot of pain when we saw her. You can see on all the cone beam slices, even though the PA looks like, oh, well, reasonably done case, when you look at the cone beams, you can see that there was even an MB2 that was sort of halfway instrumented. That center panel on the bottom row shows that something was done there. I don't know if they couldn't get through or they just couldn't fill it. But at any rate, this was a really significant event for the patient. Here it is in the pre and post-op periapical views. And some clinical photos I like to show for this case, particularly, we all know you open up these teeth and you can see the thermophil carriers in that photo on the top right. But the picture on the bottom left is once my obturation was complete before we did the buildup. And the time frame between those two photos is about 45 minutes, and that's significant. This was not something I would have ever even attempted in a single visit before, but if you get through a case efficiently, you can really cut down on a lot of that treatment time. And so the patient came back a few months later. She was about to move out of state, just wanted to make sure things were recovering and healing, and you can see some of that bone along the distal aspect of that palatal root is recovering nicely. This is one of my favorite views of any of the teeth I've treated. You can see that mesiobuccal root in the post-op photo or slice from the CBCT, a nice curtain of sealer in between those canals picked up and cleaned that isthmus readily. And then you can see 3 portals of exit, one lateral canal going off towards the sinus area. You can see there was a small mucus lining in the sinus preoperatively, and now it had cleared up. And it's always great to be able to show this to patients and let them know that, you know, that things are well on their way to healing, and they should be able to retain their tooth long term. This is another nice illustration. We all know when you look at these axial views that mesiobuccal root had the one canal that was filled in this area off to one side. We know that there's more anatomy there, and you can see in the post-op slice that there are, in fact, those 3 canals apically. So really what this helps you with is setting yourself apart. That was one of the biggest things I wanted to look at is how can I be different and unique, but at the same time be more profitable and transition to a single visit model. And Sonendo helps readily with that. They do a lot of marketing efforts for you as well. They're basically a team member of yours, if you will, and they help to drive up some of your online presence. And so now we have, we're probably the most heavily reviewed endodontic practice in the state of New Mexico, I believe. And that started to drive people in even through the online web referrals. So going back 4 years ago when we brought in GentleWave, we were 50% multiple visits and just doing about a little over 2.5 obturations a day. Currently 98% single visit, a little over 5 obturations a day. Looking at the practice economics, 3 years into this, 2016 was the last full year data I have without using GentleWave, and the sundries expenses in 2017 went up significantly. My accountant flagged that quickly and said, you've spent about $45,000 more on your consumables, although your collections went up by $100,000, so it's not an issue, but they were curious about that. They were intrigued by what we were seeing. And as we went into 2018, collections grew by about 22% over 2017. And 2019 collections were up over 80% compared to 2016. So a very significant increase in change in what our practice revenue and flow was. Of course, you know, COVID effects last year for all of us have been a significant factor. I comment that it's an asterisk year. Due to those effects, our weakest quarter last year was Q2 when everything was shut down. Of course, when you're referral based, you're not getting referrals if the dentists are not allowed to work. And our Q2 collections compared to 2019, the 2020 collections were down 48.6%. So we took a big hit that quarter. But as we got into Q4 and things were starting to feel like they're getting back to normal, we were at 99.8% of what Q4 was for 2019. And the total collections were only down about 13.7% year over year, even though we had significantly more time out of the office. And of course, through that Q2, even our time in the office, we were only operating at about 50% of our normal revenue. So what I would recommend is definitely take an open-minded look at what this technology can do for you, for our profession, for dentistry as a whole. And if you're leaning in favor of purchasing, probably better to do it sooner than later. You don't want to be the one who's left behind and the last person to get on board with this. And realize that there really is something that's better and available for us right now to incorporate into our practices and provide some better treatment for patients and referring doctors. And I think one of the most significant factors for me as a clinician is I find myself a lot less stressed out at work these days, even though I'm doing more treatments and seeing more patients. The practice flow is just a lot easier on really the whole team, where we're all noticing that effect and that difference. So thank you for your attention, and good luck in all your ventures.